Welcome to my new video. Today I am going to discuss about the clinical anatomy related to the eyeball. In our previous video we already explained about normal anatomy related to the eyeball. If you are watching our video first time, please subscribe our channel and press the bell icon to get more information about medical science, and watch this video till to the end. I think this may help you to understand this topic easily. Without wasting any time, let's start today's topic. Today's topic is clinical anatomy related to the eyeball. First, before starting clinical anatomy, let's discuss about the normal visual pathway. When the light falls on the retina, through the optic nerve, it goes to optic chiasma, through optic tract, finally in the lateral geniculated body, and in the visual cortex of occipital lobe, respected occipital lobe, where the light reflex is perception in the visual cortex of occipital lobe. There are presence of various area. That area is for visual area. The number of visual area is 18 and 19, where the light perception takes place. This is the normal visual pathway: retina, optic nerve, optic chiasma, optic tract, lateral geniculated body, and in the visual cortex. This is the normal pathway. Now let's discuss, if the lesion occurs in optic nerve, if the lesion occurs in this pathway, through the whole pathway, what are the features that we seen? Let's discuss about this. If the lesion occurs in optic nerve, if the lesion occurs in optic nerve, in this portion, in this whole portion, if the lesion occurs in this part, then the person is blind. If the lesion occurs in one side, then the blind in that respective side. For example, if the lesion occurs of optic nerve of lesion occurs in left side, then the person is blind in left side, and if lesion occurs in this right side, then the person blind in that right side. Okay. Optic nerve causes the total blindness of that side, and this is optic chiasma. Optic chiasma, there are two fiber. Here I showed this fiber, that this blue one is nasal fiber and red one is temporal fiber. If the lesion occurs in this blue fiber, that is nasal fiber, then nasal hemopenia of that side, respective side occurs. If in optic chiasma, remember this, nasal hypermetropia of respective side occurs. If the lesion occurs in optic chiasma, this whole part, if lesion occurs in this region, then bitemporal hypermetropia occurs. Remember this, they are the red are the temporal fiber, and if in this optic chiasma occurs, then bitemporal hypermetropia occurs. And if the lesion occurs in this optic tract, in this here, if the lesion occurs in this part, then homonymous hemopia occurs. Okay, in this part. Now let us discuss about common refractory error. What are the common refractory error? Mainly common refractory error are myopia, hypermetropia, presbyopia, and astigmatism. Myopia is another name of myopia is near or short sightedness, in which person can see the near object clearly, but person is unable to see the far object clearly. In this defect, person can see the near object clearly, but he cannot see, or he or she cannot see the far object clearly. This is myopic eye. Rays come from the infinity source, and focus occurs in front of the retina. This is retina, this layer, inner coat, retina, this, and focus occurs in front of the retina. In myopia, it may be the important question in various exam. It's also maybe the focus occurs in front of the in front of retina in case of myopia. The normal anterior posterior diameter, transverse diameter, and vertical diameter of normal human eye is 24 mm, around 24 mm. But in case of the myopia, this anterior posterior diameter, this diameter will increase up to 29 to 30 mm. Okay. But in a normal anterior posterior diameter is equal to transverse diameter is equal to vertical diameter, but in case of myopia, anterior posterior diameter will increase up to 29 to 30 millimeter. And in case of myopia, the curvature, there is one fixed curvature of lens, this curvature will also increase, and also the power of lens is also increased. Myopia is corrected by using suitable focal length of concave lens. Concave lens means negative focal length lens. When we use suitable power of negative focal length, then the focus occurs in the retina and person can see clearly. Now let us discuss about hypermetropia or far-sightedness. In the hypermetropia, it is just opposite to the myopia. Remember, if you remember myopia, then it will be easy for hypermetropia. In the myopia, person can see the near object clearly but cannot see the far object clearly, but in hypermetropia, person can see near far object clearly but person cannot see near object clearly, because the focus occurs behind the retina. Light comes from the infinity source and focus occurs behind the retina. So to correct hypermetropia, we have to use the suitable length of convex lens, suitable power focal length of convex lens. This is positive focal power length, focal power lens. Okay. In hypermetropia is like of myopia. In myopia, anterior posterior diameter is increased, but in hypermetropia, I already mentioned, it is just opposite of myopia. The anterior posterior diameter will decrease up to 19 millimeter. This diameter will decrease up to 19 millimeter. Same as like that, curvature of lens will be decreased and power of lens will be decreased in hypermetropia. Presbyopia, it is a clinical condition characterized by, in eye there is presence of both myopia and hypermetropia, is called presbyopia. It generally occurs in age around 40 to 50 years. It is corrected by using a suitable power of bifocal lens. Presbyopia and astigmatism, there is presence of one normal curvature of the cornea. If the curvature of the cornea is not uniform, then astigmatism occurs. Astigmatism is corrected by using cylindrical lens. Now let us come on glaucoma. Glaucoma is a clinical condition characterized by increase in intraocular pressure. There is presence of intraocular pressure normal intraocular pressure in case of adult human eye is 16 to 23 millimeter of mercury. This intraocular pressure is exerted by aqueous humor. If this pressure is increased, then this is called glaucoma. Mainly the cause of glaucoma are overproduction of aqueous humor and interference in the drainage of aqueous humor. Main cause of this glaucoma are, there are also other cause, but they are main cause. And treatment of glaucoma is, first we have to conservative treatment followed by surgery. Conservative treatment drug of choice is timolol, pilocarpine are generally prescribed in case of glaucoma, and surgical treatment is partial iridectomy is done to treat the glaucoma. Let's come to today's last topic, cataract. Cataract is generally a disease of old age, in where it is a condition, it is the disease of old age and the lens become opaque and hazy. In old age, we can clearly see a spot in the lens. Mainly the cause of cataract are old age. In old age, there is accumulation of the protein in a lens. This is called senile cataract, and it's also occur in diabetes mellitus due to the prolonged exposure with UV rays, and in case of trauma it's also occur. Now it's all for today's topic. Thank you for watching our video. If you like our video, please like, share, comment and subscribe our channel.